Dr. Lee, we talked in great deal about missing teeth and the havoc this can raise, even though as people to a very high degree, because it comes all so slow, we seem to be neglecting it. But anyway, since missing teeth can cause headache and back pain, shoulder pain, periodontal disease, and even chewing problem, if a person puts attention to it, that he should be chewing his food right. But what are the ways of replacing it now? I mean, there's lots of talk about all kinds of things, new technology coming up. Tell us a little bit about what's out there and what fits when.
Okay. Well, conventionally in the past, bridges or dentures were the only way to replace missing teeth. Nowadays implants are becoming the standard of care. Just because it's its own restoration, we replace a tooth root that's missing. And when we can replace that tooth root, the bone around that area doesn't start to resorb away. So if you were to get a bridge or a partial denture or a full denture, you would start to lose bone little by little every year. But with an implant, because it's stimulated from the chewing function of the crown, you maintain that bone. So it's as if we're replacing a whole tooth there. The nice thing is we don't have to rely on other neighboring teeth in order to support that restoration. Now, to get an implant, we definitely have to take a few specialized scans so we can make sure you have the proper bone. Because if we don't have the bone in there, we can't put an implant. And, there's a lot of things associated with it. So, we'd want to have you come in for an evaluation so we can talk to you about those things specifically, because not every two people are the same.
Right. Now tell me, give me some of the pro cons or just the difference between, let's say, a crown, a bridge, and an implant. Obviously, then the dentist will, due to certain circumstances, tell the patient what and why. But I'm sure you can, put a light on it, shade a light on it, and give us the bigger picture about it.
Okay. Well, generally with the bridge, it's just, think about the Golden Gate Bridge. They have two pieces of land on either side of the water. So in order to do a bridge, we have to cut the teeth next to one tooth on either side of that space. So, if you already have crowns on those neighboring teeth or large restorations on them that are starting to go bad, a bridge isn't a bad option. But, just like with everything, you'll have to maintain it, clean it well, go to the dentist, clean under the bridge, in order to maintain, that restoration. And, they can last a few years or they can last 20, 30 years. It just really depends on the person.
You touched on something here. So, first of all, so you have those two teeth and you said that if those two teeth themselves are broken, then maybe a bridge is not a bad option because you need to grind them down anyway, and they're already damaged. Right. But if they're in good shape, it kind of like grinding them down it might hurt the teeth, might not be a good thing. Is that what you say?
Yeah. If you have two teeth they're virgin teeth, they have no restorations or even just small restorations, we really don't want to damage them more if we don't need to. Okay. Because once you do a restoration, you're bound to maintain it for the rest of your life. So the smaller we keep everything, the better for your overall health. So in those cases, an implant would be great. Okay.
Now, then you also said something about the fact that so when you have, let's say, three teeth, the two good ones or whatever, where it hangs on it, and then the one which hangs in between, which is then that makes it a bridge. And those three teeth, or four or five for that much, they're all basically welded together, and you can't floss in between them. So that's where you said you need to go by flossing underneath the tooth, and it's very doable, but much more tedious, right?
Yeah, and a lot of patients, they don't end up cleaning under there, so they start to get localized gum disease in those areas. It's easy to get in there, floss every other tooth, but having to pick up one more item and do a little bit differently, almost every patient will say that they don't really do it.
Right, and I can see again why. Again, my wife and me are a great example. She starts brushing, and by the time she's still brushing, I finished shaving and showering. So probably not good. But I would be one of those people who would more often than not say, not today, I'll do it tomorrow. Do floss. Right. And by doing so, basically you now have a gum disease. And again, we have talked about gum disease, how devastating they are. And they will, of course, also ruin the bridge. So you need to redo it again. Never mind that at that point you ruined your kidney, your liver, maybe you increased your diabetes, and maybe for a woman, she might have premature babies or whatever it might be. So that is a good reason. And with an implant, you still need to floss and maintain very well, right, with an implant?
Right. Yeah.
But it's a little easier.
Yeah, definitely. Implants, they have a really high success rate. We're up in the 90th percentile for the success rate. Now, implants can't get decay on them, but they can still get gum disease around them. And that gum disease can cause the implant to fail still. So good oral hygiene, regular visits to the dentist are still really important, even if you don't have pain.
Mm-hmm, mm-hmm. Yeah, but the basic implant, putting that metal stick in it, which is what, titanium, the way they use it in the hip operations and stuff like that?
Yes.
Yeah. Yes. That in itself is not any more complications. That works literally almost all the time, right?
Yes. Implant placement has become pretty predictable now. It just needs to be done properly, treatment planned properly. So, over in our office, we have the patient take a lot of specialized scans. And the way we do implants, we actually plan the final restoration first, so we know exactly where the implant should go, rather than kind of doing backwards where we put the implant in there and we have to now try to jimmy the crown in there somehow, which we don't really want to plan it that way.
So you see what happens, basically before. Now, one last question. Lots of people, especially from 15, then some 20 years ago, implants were very expensive. I don't know whether the cost came down, but I think they did. But let me ask you this. When you do a bridge, let's say 3-unit bridge, which means you grind down 2 teeth, put another one in it, basically you're working with 3 teeth. You get 3 crowns, basically, even though they're welded together. Wouldn't that offset the cost somewhat anyway? Give me a little bit about, is an implant really that much expensive from the get-go? Never mind, from what you say, that the chances are that a crown and bridge fails faster and you have to replace it where you probably wouldn't yet have to replace an implant, and thus add cost to it anyway. But give us just a small idea of cost here in relation.
Well, initial placement of the implant with the crown and all the scans is going to be a little bit more expensive than a bridge, a typical 3-unit bridge. The American Dental Association, they gave an average of a bridge lasting for about 7 years. Now, of course, that's an average and every person will vary, so they can be more or less from there. So if you consider, over the lifetime, if you were to lose one of those teeth associated with that bridge, or, you'd have to replace a bridge 3, 4, 5, 6 times over your lifetime, versus an implant where you can possibly have it your whole life, the overall long-term costs are a lot lower. You don't destroy the neighboring teeth, because eventually teeth that are bridged, they may end up needing root canals, gum surgery, or just a lot of other things if they're not maintained well. So the long-term cost, the initial cost, it's not that much more than a bridge, but the overall long-term detriment to your teeth is going to be a lot worse with the bridge.
Well, thank you very much for explaining all that so well to us, Dr. Lee. Bye-bye.
Bye.